Welcome to Wellness with John. I am John Peters. I'm a therapist who's been in practice for 25 years, working with thousands of patients. And this channel is my sharing resources with you to help you thrive. So, in this video, I'm going to talk about a very, very common thing that people ask, which is, what if my husband won't go to therapy? So, stay tuned. Okay, so in today's video, I'm going to talk about a very, very common issue that bring up, which is, what if my partner won't go to therapy? And I can't give you a magic wand to be able to control your partner, unfortunately, but I can give you some thoughts and tips to set you up to be in a better position to negotiate that with them and potentially help reduce the barriers that they might have to accessing appropriate support. And be sure to watch to the end of this video, because at the end, I'm going to share a bonus resource that might help you even more in your project of trying to get your partner to be open to getting some individual or couples therapy. So to start off with, let me say that sometimes a person is wanting their partner to go to individual treatment. Sometimes they want their partner to go with them to couples therapy. Those are often related, but separate kinds of goals. And so sometimes, for example, you might have a partner who's got a depressive episode or chronic depression or anger management issues or anxiety, something where they need to do some work on their individual self, even though what they need to work on is impacting the relationship. Doing couples counseling wouldn't necessarily be the first choice, because it's not the relationship causing the problem. To some degree, it's their individual stuff that they need to work on. And this is why often you'll have a couple where each partner is seeing their own individual therapist, and then they jointly go to couples counseling with a separate third provider, because all of us have our individual stuff that's about us, and where the best kind of support is going to be direct individual kind of work, even if what's going on with us impacts our relationships, and even if sometimes couples therapy is also warranted. So sometimes you're wanting your partner to consider getting individual support in order to take care of a problem where a significant amount of it is over on their end and needs individual kind of attention, right? And so that is reasonable. And a lot of the things that I'm going to talk about that are reasons that people are resistant to therapy in the rest of this video are appropriate to individual, as well as trying to cajole them into going to couples counseling with you as well. So one thing that you want to be aware of, though, with individual therapy, whether it's your individual therapy that you're doing and wherein you're partly bringing up relationship issues, or if you want your partner to go to individual therapy for the types of reasons that I mentioned earlier, just be aware that individual therapy has not been shown to really resolve fundamental relationship issues. So when research has looked at relationship outcomes and compared people who did individual work versus people who did couples work, couples therapy has a consistent outcome of helping the quality of relationships. Individual therapy certainly indirectly can help relationships in that it helps people cope with relationship issues. But individual therapy is going to be more limited because, for one thing, you only have one person as the patient. And so as a therapist, part of what you end up doing, even if you're not strongly pursuing this goal, is you reinforce our autonomy. And, relationships are about the balance of autonomy and connection. So that's why couples therapy, couples counseling is often essential for people to improve their relationship, because couples counseling can promote both reasonable autonomy of the participants in the relationship, but also meaningful, quality, mutually satisfying connection, right? Individual therapy has a limited ability to improve the connection, the quality of the connection, because you're only dealing with one person. So as a therapist, you don't have the access to be able to deal with both people in the relationship in order to impact more directly their dynamic and have a more robust outcome of improving the dynamic. So individual therapy is limited in its ability to fix relationship issues, especially when, if I'm seeing a therapist, neither I nor my therapist have any sort of control or direct influence in the sessions over my partner, right? So including the partner in couples therapy is the most strong way that you can pursue an impact on the dynamic of a relationship if that's part of your goal. So I want to talk in this video about some common barriers that I have witnessed directly and heard about indirectly through patients of their partners not accessing therapy, in order for you to be able to potentially address those barriers with your partner if you're trying to get your partner to go to therapy and they're resisting for some reason, right? So I will tell you that in 25 years of being a therapist, working with thousands of patients, working with hundreds and hundreds of couples and families, that the number one reason that a person won't go to therapy when their partner asks is because they're male. So cisgendered males, cisgender meaning born biologically male and identifying as male in gender, I would say they represent 99% of people who resist going to therapy. And this has to do with conventional notions of masculinity, where going to therapy is seen as a sign of weakness, and also where the way that someone is masculine and male in their identity and the way that they relate to you and the family and community may mean that many males are not enthusiastic about like being in a room with their partner and a therapist, where they perceive that therapist as kind of asserting a lot of power, right? Because therapists have a lot of power in a therapy session and a therapy process. And sometimes, masculinity runs up against that because of the person wanting to have a sense of being in charge, controlling the room, controlling the dynamic of the interactions. And so it may be fearful and threatening to them to think about going and sitting in the room for an hour with someone where they're going to think that they're giving up some power. They also may not want to work with a female therapist, which, my opinion about that is, one, that reduces your pool of potential therapists, since so many therapists are female. And we male therapists are kind of few and far between when you go out and start hunting for a therapist, but it's doable. And my opinion about that is, don't get into an endless battle about whether that's right or wrong. If they don't want to see a female therapist, look for a male therapist, because a lot of males don't want the therapist then in the position of power over them. And that's an extra level of discomfort and complication that they just don't want to have to deal with in the session. The other way that masculinity, I think, provides a barrier to males going to therapy is they may be resistant to what they expect will be the influence of the male, or even if they get a male therapist, of the therapist being disruptive to their normal way of relating in the relationship. And what I mean by that is, it is true, most of us therapists have a more egalitarian approach to relationships than the general population, if you look at the variation in the population. And what I mean by that is, so the idea of, man on top, woman on bottom, by default, because of conventional notions of masculinity and femininity, therapy may challenge that to some degree. But just know that we therapists are, we're in the business of meeting people where they are and giving them the best service that we can. And so at the end of the day, you're going to go home and live your life as you do. And, we're not here to tell you like you should structure your relationship precisely this way or that way. So that's really kind of a non-issue, as long as you trust yourself to be able to assert your own identity as is healthy for you. in the therapy, right? And so, temporarily, do people have to kind of confront a more egalitarian communication and interaction style in the therapy sessions? Yes, because we therapists are going to expect that and promote that. Does that mean that we're going to kind of reach into your life and reorganize your dynamic of your relationship so that it conforms with our expectations about what it means to be male and female? Not really, So that influence will be there. It's not a bizarre worry that some men have, but it's not something that I hope is a barrier to too many people, although I think it is because of the fear of that. But again, you can assert your concerns about it if it comes up in the therapy and negotiate that with your therapist so that you're getting um, good therapy, right? Um, and so, another thing is that if you're already seeing a therapist and you're trying to cajole your partner into doing couples therapy, I do not recommend that you use your therapist. Even if you think you like your therapist a lot and your therapist is super competent and would be a really good choice in terms of their capacity to do the couples therapy, that when a partner is reticent to going to therapy, you don't really want to add extra worries on them about the quality and validity of the therapy. And so any perceived alliance that you have with the therapist before you both kind of walk in with a fresh blank slate with the therapist as a couple, that's going to undermine the partner's ability to trust the process. And so don't use your own therapist as your couples therapist for those reasons. And the other thing is, if you can get your partner to make the initial email or phone contact with the prospective therapist, that's better than you doing it, because again, your partner may consciously or unconsciously think, well, now the whole thing is spoiled and biased against me because my partner is the one initiating the contact. My partner's setting it up. My partner's giving the basic information to the therapist, so that the therapist is starting off with this framework of, I'm the bad person and my partner is the saint, right? So I tend to say, if your partner is reluctant, get the partner to make that initial contact. The other thing is that if your partner has some concern about whether they're going to be served well and treated fairly in the therapy process, if they make that contact, they could ask the therapist if the therapist is willing to have a preliminary 15-minute phone call so that they can express their concerns and get their questions answered about the process. Many, many therapists will do that. Many of us will do a brief, free phone call to answer those kinds of questions. And the reality is, we are open to very direct questions about our style. So, if someone wants to ask questions, it's not going to offend us. And if it does offend the therapist, then that's not the therapist that you need to be working with anyway. So if you can do a free, brief phone call, that can help allay some of those fears. And the other thing is that in some situations, if someone's really resistant, really concerned about how they're going to be treated in therapy, you might even ask the therapist if your partner could meet with them alone for a few minutes to ask those questions and get those concerns addressed, like at the beginning of the first session. Many therapists will agree to that kind of thing, or say, yeah, part of the first session or first couple sessions can be an individual conversation so that each of you have an opportunity to say something privately without the other one present. So that's another option. Just be aware that you can do that kind of thing. By the way, if you're liking this video, feel very free to hit the like button below. Liking the video helps YouTube learn who to share this with, and it helps me get good feedback about the videos I'm producing. And also feel free to leave comments below, because that gives me good feedback about the videos in the channel and helps me craft future videos that are going to be satisfying to folks. So here's some additional tips for helping your partner be open to therapy. One, which is a general issue for people going to therapy, whether it's individual or couples therapy, is sometimes people are reluctant to go to therapy because they think, yeah, I don't really want to open up that big can of worms that's all of my complex issues. And it just, imagining that sitting down in therapy and opening that up with no filter or limit that's just a daunting task. And then they go ahead and imagine that and then get overwhelmed by it and then say, I'm not going to do that. That's not bizarre either. But the reality is that therapy can be very focused on specific goals. And again, you can assert your own limits of how you want to you want to co-create the goals with the therapist. And it doesn't have to mean I'm going to go in and be absolutely open with no filter and have to deal with everything all the way back into my childhood or even all the relationship issues, right? Because by the time you get to the point where you want couples therapy, that's usually weeks, months, or years after the issues have really become prominent, and you know that there are complexities and challenges and issues that you need to unravel. And so, by the time you literally get to the first session where you walk in and meet with a therapist, the reality is there is too much to deal with, right? Now, the good news is part of what we therapists do is we start to hear that preliminary version of your story, and we help you co-create with us goals that are feasible within the context of the therapy process. So it's not going to mean opening up to a limitless amount of overwhelming crap that then, is going to be more miserable and that you can't withstand. It's going to be bringing it down and being specific. So how can you support addressing that fear with your partner? One way is to just assure them, look, hey, I want to go to couples therapy, and really one of the main things I want us to address is when one of us gets upset and we get into an argument, I want us to be able to do that better. So if you think about stating it that way, that's a specific focused goal, and it provides some of that fence around the limitless amount of crap that nobody wants to deal with, right? So if it's too vague, like our relationship sucks and we got to fix everything and we got to go to couples therapy, that makes people then imagine an overwhelming amount of stuff that they just think they can't deal with or that they won't deal with. The other thing is that your partner may think that going to therapy is going to label them as crazy. Only crazy people go to therapy. With couples counseling, one way to just kind of bypass the whole stigmatization of mental health issues is pay out of pocket. Find somebody you like and just don't bill your insurance. Because part of the issue with people being stigmatized by mental health diagnoses in this field is that if a session is going to be covered, whether it's individual or family or couples, the therapist has to assign a diagnosis to at least one person in the session in order for an insurance company to pay the claim. That's just the way insurance works. Many insurance companies won't pay for couples counseling anyway, but for those that do, they do require a diagnosis code for at least one person. Now, that may be a relatively benign code for a lot of people, like adjustment disorder, but if you don't really want to get assigned a diagnosis code, just pay out of pocket. And then the therapist is only going to write something like relationship problems on their note. And so they're not necessarily going to be doing a psychiatric evaluation and assigning a mental health diagnosis. Right? Another issue is that people sometimes worry about, people sometimes worry about having to perform in therapy in certain ways that just don't work for them. And so what I mean by that is if you've already been doing individual therapy, you know that, part of the process is, being present, being in touch with your emotions, communicating clearly, thinking carefully about your thoughts and perceptions. If your partner has not done individual therapy, then they may be fearful that basically when they get into the therapy, they're going to be on the spot and asked to perform in ways that they're just not really feeling up to and prepared for, and that's anxiety producing. So, part of what you can do is if you want them to go to couples therapy, one way to help them see that therapy is not as crazily overwhelming as they worry is to get them to go do an individual session, either with the couples therapist first or with a separate individual therapist, and then they learn, hey, you know what, therapy's not that bad. That's one thing that people often say is, I was afraid of it. I avoided it for years. And now that I did it, I wish I'd done it earlier, right? That's what a lot of people say. So if you can help them connect in some small way, then they sometimes learn that it's not that fearful of an animal, right? The other thing is assure them that we therapists, again, meet people where they are. We operate in this realm, and we hopefully, if you have a competent therapist, what we do is we guide with empathy and care so that people can perform adequately in the therapy process to get the best types of outcomes. So those are some thoughts I have about just thinking about your situation of, I want my partner to go to therapy and they're resistant. There may be other issues. Feel free to, leave a comment below. If you want to privately message me about that kind of thing, you can go to johnpeters.online and there's a contact form there where you can send me a message if you want to contact me privately. But I hope all of this is helpful for you. And so I mentioned that there's a bonus resource that I wanted to tell you about by the end of the video. And that is, I am going to post a separate video that's a companion to this one, where I'm going to talk directly to your partner about these same issues and give a similar explanation. And so you can go watch that yourself and see if it's something you would want to show to your partner. But if you're in a process of trying to negotiate your partner being open to going to couples therapy with you or going to individual therapy for themselves, you might want to show this companion video to them and say, look, here's a therapist talking about some reasons that people are ambivalent about therapy, and it might answer some questions you have about therapy. So I'll post that video here at the end of this one. So just look at the video suggestion that comes up here during the outro of this video, and you can check out that bonus companion video that may be an extra resource for some of you in your project of getting your partner to therapy. All right. So thanks for joining me today. Again, if you haven't yet hit the like button, be sure to hit that below, and feel free to comment. Feel free to share this video widely, and I'll see you in the companion video.